The Trauma Recovery Center at CarePlus, New Jersey is a comprehensive mental health program that provides wraparound clinical services to individuals and families who are survivors of violent crimes. My name is Meredith Williams. I'm a licensed professional counselor, a director with CarePlus, New Jersey, and the clinical coordinator for the Trauma Recovery Center. The Trauma Recovery Center is a grant-funded program that CarePlus was awarded through the Attorney General's office. The TRC is a national model, and our program is one of 4 in New Jersey and one of 39 across the United States. Our services are provided free of charge to survivors, regardless of their insurance or immigration status.
My name is Sue Heggie. I'm a licensed clinical social worker and the Associate Vice President with CarePlus New Jersey and the Project Director for the TRC. CarePlus New Jersey is a leader in trauma-informed, inclusive mental health care. We have been serving the Northern New Jersey community for over 40 years and currently manage over $40 million in funding from various sources, including the Substance Abuse and Mental Health Services Administration, the New Jersey Department for Children and Families, and the Division of Mental Health and Addiction Services. Our support services are provided with respect, compassion, and cultural competence to promote healing. Since the start of the TRC in October 2020, we have served over 275 individuals, and 85% of those who completed the program have shown improvement in their trauma symptoms.
Nobody plans on being in an abusive relationship, but it happens, and it's very hard to get out of. And when the abuse becomes too much and it becomes violence and the police get involved, then you are totally traumatized, and so are your children. Thank God that I was connected with the Trauma Recovery Center. My children and I were given counseling, and we were able to get back on our feet. They provided us with resources and helped us gain the strength that we needed to be ourselves again.
My name is Diana Riccioli, and as the forensic psychiatrist on the team, I work with the multidisciplinary TRC team to assess the individual or family, prescribe medication, and develop a treatment plan alongside the program leadership and clinical case managers.
We work with children and adults ages 7 and up who live in Bergen or Passaic County who have experienced a violent crime or complex trauma. Our goal is to facilitate recovery and holistic wellness by providing comprehensive mental health services. Our team is trained in trauma-focused cognitive behavioral therapy, and our leadership works to ensure that we are always up to date with best practices and evidence-based approaches to treatment.
Our team receives support, consultation, and specialized supervision from esteemed experts in the field. So, for example, all of our clinicians are also certified in eye movement desensitization reprocessing, or EMDR.
I am Maria Mascindaro, the clinical psychologist who works with the TRC team at CarePlus New Jersey. Evidence-based practices such as EMDR are the mainstay of the clinical teams. CarePlus ensures that trauma-informed care is provided to every client from first contact through discharge. The goal is to provide rapid access to high-quality care and support to those who need it most.
We know that it is important to meet people where they are at, so the TRC also includes a major outreach component. We attend community events, build partnerships, and innovate ways to ensure individuals and families know that these services are available.
To ensure seamless access to care, we have a dedicated admissions and triage process. We also know that privacy is especially important for our survivors. So, we have an entire wing dedicated to the TRC in the CarePlus New Jersey Children and Family Services building. Our therapy offices are designed with comfort and safety in mind.
As part of the healing process, we are also sure to remind program participants that they are not alone. For those who have survived a violent crime or have experienced significant trauma, having a peer to talk with can go a long way.
Trauma is really hard to comprehend and very hard to understand, and it's very confusing. However, The counseling that I received at the Trauma Recovery Center allowed me to process what was going on, plan what I was going to do, and how I would get there, helped myself and my children get on our feet again and see things much clearer. Thank you, Trauma Recovery Center.